And good afternoon. Welcome to Welcome Home. Kevin Miller here with you on 107.5 FM, 580 AM, KIDO Talk Radio. Hope you're having a great Saturday afternoon. Wishing everybody an early Happy New Year. Hope that you had a Merry Christmas. Joining us from Garden Plaza of Valley View is Dee Childers, president of the IGFA. We'll talk about that organization in a minute. Owner of Life Changes Elder Care Consulting. Julie Robinson is our guest as well. She's the owner of Seasons Care Management. And when we're talking about the IGFA, we're talking about the Idaho Guardianship Fiduciary Association. Dee, those are a lot of big words for a humble guy like me, so good to have you with us once again.
Thank you, Kevin. Good to be with you.
You know, this is a scary part. On one of our last shows, we talked about your concerns, what got you into the business, the idea of guardianship. Can we expand on that? And off the air, you provided us with a lot of definitions. We don't want to waste that for our on-air audience. So guardianship, what does it mean here in the state of Idaho? How does it work?
So guardianship is a legal concept where the individual who is placed under guardianship by the courts loses essentially all of their legal rights. And that's not done lightly. It's done primarily to protect them. So there's three groups of folks that typically fall under guardianship. Would be older adults that are having decisional capacity issues. Dementia is a primary cause of that. Persons who have developmental or intellectual disabilities, and those that have a mental illness that affects daily decision making. There's two concepts to guardianship. So guardianship at the national level is the big picture name. There's guardian of the person and guardian of the state. And in Idaho, we call guardian of the state a conservator or tor, and guardian of the person is a guardian.
Boy, is there any type of certification that someone has to go through? Any type of vetting process to do this? I know we have the website idahoguardians.org for more information for the public, but if you want to be an accountant, you have to pass a test. What about for a guardian?
Well, several years ago, the state of Idaho did implement some required training that an individual go through before they can become a guardian or conservator. And that is required through the court system. It's basically on the court website. Anyone can take that training, but I'm not sure, Julie, do you know how they would go about doing that other than getting a hold of the court clerk?
It's part of the process in becoming a guardian, whether it's for a family member or a friend or as a professional. Professionals have to go through it as well. The Idaho Guardian and Fiduciary Association is working with Ada County to develop a process and some other type of trainings that have to be completed in order to be a guardian or conservator for somebody that more than two individuals. And that would be through the National Guardianship Association, possibly doing their training in the state of Idaho, implementing that as a required training for Idaho.
Now, our friend Dee here, who has done an excellent job, as always, of producing this show when she's here, said you are an actual guardian, correct?
Correct. I'm a professional guardian.
So can you take us through that process? I couldn't imagine dealing with the family, making these decisions. There's a lot on the line for someone that does the job very well. And as Dee has told us, there's a lot of concern that people will get ripped off as well.
So are you talking the order in which to obtain a guardian or conservator?
Well, we can get to that, but just the process that you go through of someone calls you up and says, I have Pop or Uncle Willie, and all of a sudden they're not capable. We trust you, Julie, to handle his affairs.
So a lot of times when somebody calls me, it can either be the family member who's asking questions about this is what's going on, or number two, the referral will often come from an attorney because it is a legal process. It does go through the court system. And so if somebody calls me, I refer them to an attorney to get the process started. And yes, either I can be the guardian, the family can be the guardian, and then I help as a care manager, help them through the process and help them understand their role and responsibilities as a guardian.
How did you get into it?
I'm a social worker by trade, and when I moved to Idaho, it was a profession that I got into working for a local organization, and then over several years and working in some different fields in the valley, I decided I wanted to start my own business as a professional guardian and care manager.
Sure. And by the way, if you're listening on 107.5 FM, 580 AM, KIDO Talk Radio, here are some very important websites: lifechangeseldercare.com, also seniorcaremanagement.com, and idahoguardians.org. Is this an expanding field? Are we, because the population is aging, or how does that?
I anticipate that it will expand, especially as we have a huge population of what some have coined elder orphans, people who do not have anyone to support them, family members, so they don't have any health care power of attorney. And when it gets to the point they're not able to implement a health care power of attorney for many decisions, then often the courts have to become involved, and guardianship and conservatorship can be appointed. So one way to avoid guardianship and conservatorship is to make sure you have your legal documents prepared ahead of time when you have the decisional capacity to make them. Because ultimately, while Julie and I both work and experience this real time every day, the ultimate goal is to avoid guardianship. And you do that by making sure you have your health care power of attorney and for finances and for health care already completed.
What would happen, though, like you said, if you don't have a family member? Would you make that an attorney or somebody you trust? How would you, if you're one of these orphans that you were describing?
Right. So there are a few of us that will serve as a professional health care power of attorney. And Julie and I just happen to be two of those people because we already work in that business. Not everyone is willing to assume that responsibility. But you can hire Julie and I to be your health care power of attorney. We have certain requirements. Primarily, we want you to have a family member or a close friend do that first. But as a last resort, or very near a last resort, we're willing to do that. But ultimately, we think family members serve that role better, and then we can support them in the day-to-day activities, in care management and medical advocacy.
You know, when you deal with young people or elder people, really anyone, everybody's stubborn. You know, recently it's been the family season, and you get along with people, and then all of a sudden, no one wants to take direction. Is it a challenge taking over, being a legal guardian for someone, a professional guardian, when you have the decision making? I mean, all of a sudden you've got your client, your patient, and you have to make the decisions for them.
Definitely. And in being appointed the legal guardian for somebody, a lot of the reasons I'm appointed are financial reasons. So somebody's been exploited, whether that's from a neighbor, it's from a family member, a friend, and so then a lot of times there can be some family conflict. So then I'm appointed the legal guardian, and I have family members telling me things and suggesting things that I should do, and I explain to them my ultimate role is I'm here for your family member. I'm appointed to help them, and I'm going to listen to everybody's input, but I'm going to go back to what would they want if they were able to make the decision. So it's learning to work together with all of the family members, and be aware that there are disagreements and things that come up that can make it challenging at times.
I would imagine.
Absolutely.
Have you been in the fray and the fracas at all on this?
Well, fortunately, as we talked about last time, I'm in a very cooperative family, and actually I am co-guardian and conservator for our father with both my sisters. That's an exception. I think the courts at this point in time are very reluctant to even appoint with two people, let alone three people. So that just became a gift to us because of the dynamics of our relationships. Families, however, are typically built with strife. And so finding someone that can kind of be the mediator and walk that line to be a good ear and yet still make decisions based on the best interest of the individual under protection.
Now, here we are at Gun Plaza, Valley View. Can you both describe your relationship with the folks here?
Sure, definitely. In the ways that I've worked with Valley View is in relation to actually in the care management role and working with families that have loved ones here, that they're their actual legal guardian. And so, sometimes it's somebody that's local here. It just needs a little bit of help and support. and learning all the ins and outs of working with communities. And then sometimes it's a family member that might be out of state, and so then I've been hired for residents here to attend medical appointments and sit in on care conferences because their family member lives out of state.
Imagine you'd have to take a lot of detailed information because the family member would like that.
Yes, definitely, and emails back and forth and updates with any concerns they might have that I can address and report back all the great and wonderful positive things as well.
Sure.
You know, there's often things that family members don't know about when their senior family member moves into a facility, like what to expect from them. And that's one of the things that we can do is to help be a guide and coach, like periodic care conferences. What's going on? What's going well? What areas need to be shored up? Are there changes that need to be made, additional services that might need to be brought in, like home health, because there's some physical issues going on. And because that's what Julie and I do every day, that's just second nature to us. That just comes about. So family members benefit from having somebody that does this all the time, whether they're here or a distant caregiver.
We'll talk more about that coming up. By the way, here are some great websites. For more information, seasonscaremanagement.com. If you want to get a hold of Julie, you want to get a hold of Dee, lifechangeseldercare.com. And for more information on the Idaho Guardianship Fiduciary Association, idahoguardians.org. You're listening to Kevin Miller on KIDO Talk Radio. And welcome back to Welcome Home here at Garden Plaza of Valley View. We continue on talking about the Guardians and the Fiduciary Association and really what it takes to take care of your loved one. What advice would you guys give people listening right now that have just tuned in? Maybe they haven't heard any of the previous segments when it comes to, and Dee, we've talked about this before. Well, they're doing good. We'll let them hang in there for a little while longer.
Well, and that's nice. I think independence is really key. We all want to be independent. We don't want to be a burden on our family. And yet we do need people that love us to have some oversight about what's going well and what might not be. And the holidays are one of those times when families might be coming home to their parents' house or grandparents' house, some other relative, and they notice things that they hadn't picked up with the phone calls or the visits out of town, that things have changed, things have deteriorated, and they need to start paying attention to making sure that the individual is protected, that they don't have other people coming into their lives trying to exploit them. Unfortunately, both Julie and I have lots of horror stories we could share about people losing their homes because someone from even the church has come in and said that they'll take care of them if they'll just sign over their house. So family members need to be paying attention.
Boy, are there warning signs that we should look out for?
I think, things that family notice first might be mail. Mail might be piling up. There's bills that are going unpaid where they once were able to manage that and balance their checkbook. Now it's a little more disorganized in the home. I think that's one of the first things that people can notice of just looking around the home when they walk in is maybe it's not as organized as it used to be, and there's bills that look like they're unpaid and past due notices.
I'm sorry, Dee, go ahead.
I was just going to say, looking in the refrigerator, oddly enough, is another really important thing to do. If you see a lot of frozen food or maybe no food or minimal food in the refrigerator, that can be a very good clue that they're not getting good nutrition, and so another reason to have an intervention.
Let's talk a little bit about, and Dee, you've talked about your experience in the past with Alzheimer's and dementia. Julie, let's talk a little bit about yours. Volunteering and being active in the Alzheimer's Association.
Definitely, leading support groups through the Alzheimer's Association for 10 plus years now, and then I did work with the Alzheimer's Association for a couple of years as well. In my background, gerontology degree, and so my true passion and love is working with the elderly and those with any form of dementia. Something I really enjoy.
Where does that passion for working with the elderly come from?
I get asked that quite a bit.
Well, I'm glad I'm in good company.
I go back to my grandma. I was raised by parents that both worked. I was the surprise child, so there was many years in between, and my mom was working again by then, and so I'd go to my grandma's house after school, and I'd spend a lot of time with her, and so I grew to really, enjoy being around her, and I think it carried over into, the field and the work that I do now.
Dee, let's talk a little bit about IdahoGuardians.org. We've got some classes coming up, and want to make sure that everybody knows this, because again, people are out driving around. Maybe they're tuning in for the first time, or they're visiting. They're back here in the Treasure Valley, and this is top of mind. IdahoGuardians.org, some classes for people to really get some good unfiltered information.
Excellent. Thank you, Kevin, for bringing that up. I'd like to just back up and provide a little information about the organization. We are an organization for professionals as well as family members. And a big part of our intention is to be able to provide a foundation and a safe place for those family guardians and conservators to come, be with other people who are professionals, and get advice, get information. We provide a lot of information about resources in the Valley that will support the person under protection, as well as the formal classes that we do. So this year, 2019, we have a series called The Fundamentals of Guardianship coming up. It's a 4-part series for family members. It's pretty close to as free as you can get. We ask for $5 per class. The first one is the basics. That's March 28th. Guardian of the Person is the second session. That's April 18th. Guardian of the Estate, also known as the Conservator, is May 9th, and Rights and Alternatives is May 30th, and these dates will be on our website just shortly. But we will also have an annual event this year towards the third or fourth quarter, where we bring in a lot of additional resources and professionals to provide information and support to both professionals and family guardians and conservators.
When we take a look at, we were talking with Julie moments ago about her work with Alzheimer's and dementia. We always touch on this, but do you expect that to be a continuing problem?
Unfortunately, it's going to be a huge and potentially catastrophic problem that we have going forward with all the boomers passing 65, and we know there's 10,000 of us a day reaching that milestone. And the largest cause of Alzheimer's disease and many dementias is age. And so as we age and we live so much longer, that likelihood is going to increase.
And then it comes down to, again, making that decision of when to hire someone like you or Julie.
Correct. Earlier is better. You typically use our services only when you need them, but to have an established relationship with one of our companies is really valuable. We know who you are. We know what your medical history is. We know what your goals and objectives are for aging, which is really important. We're kind of the unique individuals. We're comfortable having conversations about aging and death and infirmity and asking those hard questions so we know what's important to you, what quality of life looks like.
Let's go back to these classes that are coming up. I love this one, the guardian of the estate, the conservator. How is that different than being the guardian of the person? Aren't they one and the same?
Well, no, that's a very good question, Kevin. Guardian of the person really has more to do with the medical health of the individual, where they might live, how they socialize, everything about the person, where guardian of the estate is really about the money piece. The cost of things, if they have investments. So anything that's related to money is guardian of the estate or conservator in Idaho.
I would think they'd still kind of be one and the same, because I would say to pay for everything you need the estate, but they can be separate.
Actually, most of the time they're separate because they're really two distinct skill sets. I don't want to be guardian of anybody's estate. That's not my expertise. That's not what I do well. And most guardians of the estate don't want to do the healthcare piece of it too. So really there's a real specific professional depth that comes in both professions, and they must work closely together, no question about that. It's a team.
It is a team. Julie, anything else that you'd like to share with us today?
If I might add a little bit to the guardian of the person and guardian of the estate, like Dee mentioned, it is different skill sets. And so if it's family members that are guardian of the person and guardian of the estate, there are definitely certain things they need to be aware of when working with their money or their property, and helping them, qualify as their money and resources start to dwindle, helping them qualify for, Medicaid services, or getting them on Medicare if they're a little bit younger and are starting to qualify for that. So, and that's why these classes, came to be, as well as we know what, these things take, but working with the family members, we want to educate them and make sure that they're also doing what's in the best interest of their loved one too.
And Kevin, if I could just chime in on that, we just started with a new client who is actually guardian and conservator for his parent, and he really did not truly understand the full responsibility of becoming guardian of the estate. And there is an accountability to the court system. And annual reports are required by the courts, both for guardian of the person as well as guardian of the state. And with guardian of the state, there's an annual accounting. So you need to account for any money that is spent on behalf of the individual under protection. And that means having receipts and being able to justify any expenditures there. So it is not a free-willing extra pot of money that somebody has to spend.
Well, that is reassuring. IdahoGuardians.org. Dee, your website?
LifeChangesElderCare.com.
And Julie?
SeasonsCareManagement.com.
We thank you both and appreciate you coming in.
Thank you.
You're listening to Welcome Home, 107.5 FM, 580 AM, from Garden Plaza of Valley View. Kevin Miller, your host. Every week we have a chance to take a look at senior care. We also talk to the residents here of Garden Plaza of Valley View, as well as the staff, and just find out the good things going on right here in the Treasure Valley. Coming up next, we'll talk to a resident that has a historic past when it comes to the Boise State football team. That more coming up next, 107.5 FM, 580 AM. Welcome home on KIDO Talk Radio. And welcome back to Welcome Home. Kevin Miller with you, Garden Plaza of Valley View. We've got our good friend Leo with us. Leo, how are you?
Fine, thanks.
Leo, tell us a little bit about yourself. You're a new resident here.
Just like that, yeah.
Yeah, we just go.
Well, it's just a great place to be, but it takes a while to get acquainted with the people, and remembering names is pretty difficult,
Sure.
So it's fine. It sure is.
So what was it like moving in? What was it like? Was it fun? Was it exciting? Meeting new people?
Well, it was just a routine thing because I'd come out and looked at it before. We just said this. My sons were with me on this, and so then they were out here with me, and we moved in, and that's been about 3 weeks ago.
And here we are today.
That's right.
Having a good time. So let's go back to your football playing days.
I started out in 1947 for Lyle Smith at Boise Junior College, and we went undefeated, and he continued on undefeated for several years after that. But from the junior college, Lyle knew the coach down at Idaho State, and he got me a 2-year. I was at BSU twice, 2 years, BJC 2 years, okay, and then at Idaho State, went down there and played football for the Bengals for a couple of years, and graduated and went into coaching.
Now, I got to go back to your time at Boise State. Did you ever think it would be as big as it is today?
No, we didn't consider that it was a junior college, and we didn't realize it was going to advance. They had the University of Idaho and Idaho State for the 4-year schools, but the growth at Boise Junior College was great.
And now, are you more of a Bengal or a Bronco?
Oh, I'm a Bronco. I had season tickets for them for many years.
And you went into coaching. Can you tell us a little bit about that?
Well, let's see. I graduated from Idaho State and went to CUNA. I went to CUNA High School, so I went back to CUNA and coached for 2 years, and then went to Baker, Oregon. Oregon played a couple of $1,000 a year more. They paid their salary was much better up there. Anyway, I went up there and I spent about 18 years at Baker, now Baker City, and I had 27 years altogether in coaching.
And coaching football?
I did all of it. I was athletic director at Baker, and I assigned myself baseball, and I was the offensive coach in football.
And what kind of offense did you run?
Oh, T formation, single wing, whatever might come up.
Now, for me, the wishbone has always been the best offense ever. Not these people that throw the football, the wishbone. What do you think?
I wouldn't buy that. It's good, but you've got to have this other too. That's for sure.
Uh-huh.
But I thought the single wing was great if you had the right tailback and fullback. I mean, that was a great offense.
Right.
Lyle Smith ran some T formation and some single wing both. So
And
we got
that's
acquainted with that.
And that's what you ran.
Something of that nature, yeah.
Yeah.
But mostly it was a T formation football, single wing T.
Now, what do you think of all the spread offenses these days? You know, people spreading out.
Well,
throwing the ball.
that's just that's a part of the game, making the defense change a little bit
Right.
and taking chances of making a big play out of it.
So, where were you before here?
Well, I've been living at Aspen Creek Senior Park,
Right.
and was there for 22 years. My wife passed away 3 weeks ago,
Sorry to hear that.
and so the boys got together with me, and I have 5 sons and a daughter. And the 5 sons, they kind of organized together, and here I am, and it was their help that got me here, and I'm pleased to be here, yes.
Well, have you had a chance to do any of the activities here yet?
Not particularly.
I hear they play poker here and
Yeah.
cards. And,
Well, these guys are too sharp for me.
yeah.
I'm for pinochle. Not really. I just don't play much cards.
How would you describe the staff here?
I don't know them that well,
Yeah.
but they're certainly friendly and competent and
And the
answer my questions when I've had plenty of them.
Sure.
I appreciate them. Yes, I sure do.
so when you take a look at just some of your favorite things to do, you still follow sports?
Say it again.
You still follow sports?
Oh, yes. Yeah. Went out yesterday. Sunday was it? When the boys, Saturday, when the Broncos were going to play and got rained out or something.
Right.
Well, I was with 3 of my sons, and we were going to watch the ball game. So we watch sports all the time.
Right. And you're a big Notre Dame fan.
Yeah, I'd use the story. I went to Notre Dame.
Right.
Well, for a ball game. I didn't go to school there.
Right.
I have some relatives back there, and they got a couple of tickets for me and my wife, and we flew back there and watched Notre Dame play. Watched them beat Southern Cal. What a great game that was.
What was that like for you to be at Notre Dame Stadium?
It was awesome. I even went in and saw Frank Leahy for a little bit, and friendly man.
That's very nice. So, do you get to go to Bronco games at all? Would you like to go?
Oh, I don't go now, but for a buddy of mine, Bernie Nielsen, we had season tickets for probably 30 years down there with our wives,
Right.
and we went all the time.
It's a lot of cold weather.
You don't. If you're going to be a football fan, you do not consider the weather at all. You hope it's sunny, but
When it comes to coaching, let's go back to coaching. What was it like to be so influential in the lives of young men?
you had to be fully aware of that's what it was. And then you went coaching, and as long as you played it fair with them, I mean, it was a great way to go. I wouldn't trade that occupation. I might trade the paycheck for somebody else, but no, that was good too. I shouldn't have said that. But the coaching was first year I was at Baker. I'm not at Baker, but Oregon. I left CUNY and went to a place called Richland, and I coached everything. It was a small school, 90 student body, and it was fun, total fun. But then I had a chance to move into Baker, a bigger school. They played the Portland schools and Pendleton and all of that. And that's where I enjoyed it, really enjoyed it.
Now, did you just coach an AD, or did you teach school as well?
I was I taught some physical education classes, maybe for half a day, and then I was athletic director, and it all tied in that way.
So when did you retire?
I don't really recall. Like you're talking to a guy 92 years old, and you want me to remember things.
You're 92? You
Yes.
don't look 92.
Well,
You look good.
yeah, and I feel pretty good.
Yeah. So anything else you'd like to share with us?
I could say go Notre Dame, but then not everybody out there cares.
Right.
So I will push that. No, this is I'm glad I'm at this place now, with my wife being gone, and this helps with the needs real well.
Sure. Like eating.
Like eating, is that what you said?
Yep, that's what I said.
That's certainly part of it.
Right, indeed. And meeting new people.
Now, that's tough. I have no idea who they are the next day. I mean, 92, you don't remember everything, but here there's so many of them, and this is a compliment. Almost all of them are white-headed. They're gray-haired, pretty women. I mean, and the men are either gray-headed or bald. I'm not putting anybody down. I'm saying it's great, but try to remember their names with those. It's hard to do. But I can say hi and we smile. That's the best way to go.
Indeed, those are life lessons, huh, Leo?
Beg your pardon.
Those are life lessons, right?
Yes, they sure are.
All right. Well, Leo, we appreciate you. Thank you.
You're welcome.
We'll talk to you coming up next. I think this young lady probably needs some help here. Kevin Miller with you, Garden Plaza of Valley View, 107.5 FM, 580 AM. Remember, every week we are here talking to folks like Leo. Coming up, we'll talk to the staff. And, of course, we always have some information when it comes to elder care. And if you have any questions, obviously you can contact the professionals here at Garden Plaza of Valley View. And coming up, we're going to be talking to more experts. If you missed any of the segments of the program, you can go to YouTube and catch all of these episodes as we move along. Remember, in the earlier episode, we had a chance to find out about guardianships. So if you have a question about guardianships here in the state of Idaho, idahoguardians.org, or you can also look up our friends at seasonscaremanagement.com, Julie Robinson, and and our friend Dee Childers, her website, of course. We'll get to that here, lifechangeseldercare.com. You can reach Dee at 208-321-5567. That's 321-5567. Or Julie at 321-5522. You're listening to Kevin Miller on Welcome Home, KIDO Talk Radio. And welcome back to Garden Plaza of Valley View. Welcome home. Mike Briggs with us once again from Keystone. Talk a little bit about elder care. Mike, good to have you.
Nice to be here again, Kevin. I always enjoy having the opportunity to talk about hospice, but also to talk about anything that can help our seniors in our community thrive.
And by the way, let's get the phone number out for you so people can get a hold of you.
Yeah, the phone number at Keystone Hospice is 208-996-8181, and we'd be happy to assist you if you have any questions, concerns, or if you have a loved one that needs our services.
You know, when people that work in hospice, as we've noticed here, they have a sense of calm and such, but for the rest of us, that word is just so darn scary. Where does your calm come from, and can you help alleviate some of our concerns?
Yeah, absolutely. I think when it comes down to it, we have two really gigantic things that happen in our life that are special, and one of them is birth, and one of them is death.
Right.
And when it comes to the dying process, we want to make sure that we surround ourselves with people that we can help them, surround the family, and help them as being an expert to help guide them through that journey that they have at the end of their life. So the reason that I have calm is that it's a special time in our life, and it's an opportunity for us to really wrap our arms around the loved one, around the family, and even when we're partnering with facilities such as the Bridge at Valley View or Garden Plaza, we want to wrap our arms around them as well, because they're part of the family as well. So it's about giving love at the end of life and making sure that the person that's had a really good life here on earth, that they have a good passing, that they are treated well with dignity and respect, and are able to make that transition as they go. So it's really a fabulous opportunity for us to come into a time when a lot of times it's chaos or crisis mode for the families.
Right.
And so we can come in and we can kind of answer a lot of the tough questions that they may have and ease their anxiety.
You know, we always talk about alleviating the burden from the caregiver, Mike, but on the other hand, you know, you've got the hospice worker, the hospice caregiver. That's a lot of pressure, getting close with someone, caring for them. You know, how would you describe that?
It's very special. In reality, a lot of the time we become their family. So it is hard on our staff sometimes, but that's why we have at Keystone, we have fun days every quarter where we take our staff out and we do something fun. Like one quarter we went to the Boise Hawks game and we took everybody and we had fun. Another time we went to Wahoo's and went bowling and played video games, and we took 2 hours out of a day to just spend time and taking care of ourselves. But there's other things that we do at the office to help have self-care, and that one of the things that we do is we have memorials once a month where we just go over all the folks that we helped the month prior, and we light a candle for each one of them, and then we kind of reminisce about those people that we get the opportunity to come into their lives and help them at this time in their life.
What advice would you give people?
The best advice that I would give somebody is that don't wait. If somebody has been diagnosed with a terminal illness and they have less than 6 months to live, there's no reason to wait to get on hospice. It's a true benefit that everybody that has Medicare is able to participate in, so that they can really get the full benefit of the hospice benefit. If they wait, a lot of times, some people are only on services for like a day. Sometimes they're only on for a week. So we truly would like to get in there sooner so that we can give them the full benefit where they get all the services, the social worker, the chaplain, the RN case manager, the CNA, the volunteers, the complementary alternative medicines that we provide, the veteran services coordinator. When it gives us more time, then we get to build that relationship with that client and their family, and it really makes it for a better outcome when we have that opportunity to have more time with them. So my biggest advice is to don't wait to get on hospice. Do it as soon as you have been given that diagnosis that you have less than 6 months to live.
You're listening to 107.5 FM, 580 AM. Mike Briggs joining us from Keystone Hospice. What about the actual patient? We've been talking about the family and such, but you know, we all want to, some people want to live forever. Some people maybe have a more fatalistic approach, but the patient, helping them comprehend that you only have 6 months left to live.
So that's a great question, Kevin. That's why hospice is set up the way it is. We have social workers and chaplains that we're not only treating their body, their signs and symptoms with the RN case manager, but we're also helping them with their psychosocial aspects of this process, and then the spiritual part of this as well. So we are treating the whole body as a holistic part, as the mind, body, and soul. And so when we have that opportunity to have more time with them, then the social worker and the chaplain can do more of that work with the family, more work with that loved one, that patient, so that they can be in a good spot when they do get closer to passing away.
So it's a team concept, as you said, a holistic process instead of just one person.
Absolutely. That's the one thing that's really cool about hospice, is that you're getting a multidisciplinary team. So you've got an RN case manager, you've got a CNA that helps with all the personal cares, you've got a social worker that helps with we like to get the life story of our patients, so then we can share that with all the team, so then we can better care for that person.
Sure.
But they also help with the psychosocial aspects, dealing with maybe anger or grief. Some of these patients feel grief before they even, they can have those feelings. So having that social worker there to talk about those things, and then having the chaplain there to help guide them spiritually. We meet them where they're at spiritually. So like if they're Mormon or Christian or Buddhist or Hindu or whatever they are, our chaplain comes in and helps guide them wherever they are at spiritually. We're not there to try to proselytize them to any religion. We're there to just help them where they're at spiritually, so that they can make that process at the end of their life
And
the best that they can.
That could either be here or at a hospital or in their own home.
So typically we don't do hospice in the hospital unless it's general inpatient care. Typically, most of the hospice is done in a patient's home, their assisted living, or their nursing home. That's the three main places where we do the hospice care.
Sure. And, having the family there and coordinating, even doing I would imagine the logistics of a funeral can be overwhelming because nobody wants to do that.
Yeah.
Nobody wants to plan for their own funeral. Very few people do that.
Sure.
And then finding out the funeral director, where you want to be buried, that sort of thing.
You bet. And a lot of the times that's where our social worker and our chaplain come in and are heavily involved. The social worker can help tie up all those things and getting all their power of attorney in place. Sometimes that's done prior to us, but sometimes it's not. Getting the funeral home taken care of, knowing where they want to be sent after they pass, making sure that all their affairs are in order. That's what our social worker will do, and then our chaplain will help. Sometimes our chaplain does the ceremony for their memorial or their celebration of life. They're usually heavily involved because they've built that relationship with that patient, and that patient says, well, I want you to do my service when I pass away. So we do a lot of those, especially at the VA cemetery. We do a lot of veterans ceremonies out there. A lot of our chaplains end up doing the memorials and funerals for our patients. It's a special time.
I've been up there for a few of them. Mike, finally, your phone number once again, website?
Our phone number is 208-996-8181, and our website is www.keystonehospice.org.
Are there any dumb questions?
I don't consider any question a dumb question, because I've had a professor back at Boise State when I was at Boise State that would say that there's no dumb questions, especially when it comes to end of life, because we don't talk about it a lot here in the States. But I think it's something that we're trying to break that stigma, and we want people to talk about it because it's such a valuable moment in our time of our life. So we want to make sure that we try to destigmatize hospice and destigmatize passing away.
Indeed. Mike, thank you very much. Appreciate it.
Thank you.
And once again, reminding you, you're listening to Welcome Home, a publication, a production of Garden Plaza of Valley View, every week at this time, 2 o'clock on 107.5 FM, 580 AM, KIDO Talk Radio. Kevin Miller wishing you a great day, and don't forget Dr. Rosie's next on KIDO Talk Radio.